Hi, my name is Santia Jones, and my topic of discussion today is empowerment. To me, empowerment means to give power to enable, or to permit someone to do something. In this case, I'll be discussing what empowers nurses to be better nurses and one day successful leaders. I read an article, and the name of that article was Impact of Nursing Practice Environment and Psychological Empowerment of Nurses Work Engagement. 300 nurses were taken from two of the top hospitals in China. Now, these nurses, they were surveyed on what keeps them or motivates them to be engaged at work. The study concluded that psychological empowerment and the type of work environment that the nurses worked in had a great impact on how engaged the nurses were at work. The nurses also gave insight into what it was that made them feel empowered. Those things that made the nurses empowered were having the autonomy to make decisions regarding their patients' care, feeling like their opinions mattered, being praised for a job well done. The nurses said being appreciated, valued, and respected made them feel empowered. Having opportunities for advancement within the workplace, having positive nurse to physician relationships, and last but not least, having a healthy, positive work environment. All of these things together help the nurses feel empowered. So let's discuss some of these things. Having the autonomy to make decisions regarding your patient care, yes, that's a must, especially in critical care fields. I work in the ICU, so having the ability to make decisions on my patient's care without having to ask my doctor first, it really takes the stress off at work. Say for instance, if I had a patient crashing, sometimes I don't have time to find the doctor and call them and say, hey, can I start this or can I hang this? I just do it. Feeling like my opinions matter. That's a big deal, I want to feel like I have a voice, that, someone is listening to me, listening to my concerns, my problems, and my issues. And also, one of the things I left out was the nurses felt that having a manager that cares about them gives them empowerment. Yes, I agree with that too. I have a manager who I generally feel like she cares about me and cares about all the staff, Being praised for a job well done. Everyone wants feedback. Everyone wants to know that they're making a difference, that their job is being appreciated. Having opportunities to advance. That's another thing. No one wants to feel like, okay, all I can be is a bedside nurse. I like the idea of knowing, okay, that one day I can be team lead, or I could be rapid response nurse, or I could become a nurse educator. Our organization, we have lots of opportunities to advance. And having a healthy work environment and also a positive nurse to physician relationship is a must for us as well. We have an intensivist on our unit 24 hours, 7 days a week, and we have to deal with him on a day-to-day basis, and it's nice to have a doctor that doesn't belittle you or put you down when you don't know an answer to a question, or if you assess a patient wrong. All these things do help empower us as nurses. So yes, I agree with the article. These things are all important facilitators for the empowerment of nurses. I personally feel that being empowered will enable me to be a better nurse as well as a better person. It will encourage me to live up to my fullest potential. Being empowered gives me the motivation to continue with the further of my education. And we all know that education is the key to success. And there's no such thing as too much education. So yes, feeling empowered sets the foundation for me to lead others in the initiative to elicit change. And in the end, it all boils down to, feeling like someone cares, and just like the nurses mentioned in the article, they want to feel like they're being valued, respected, that their nurse cares for them. So feeling as if someone cares for me empowers me to care for others. There's a saying, a powerless nurse is an ineffective nurse, and an ineffective nurse delivers ineffective care to their patients. So we as nurses need to be empowered, and we must also empower others. Thank you.